Dr. Clark and I met through mutual acquaintances. And one thing I've always on the look for is a good physician. And they're not easy to find. A person who's caring, who's thoughtful, who's, present, whose goal is the person in the room with them. That's all they want to do. They want to be the best person they can be in that moment with that individual. And so that's finding a person who's brilliant, who doesn't have a big ego, whose goal is not themselves, but the real art of what we do and being brilliant at it and trying to excel at it constantly. And when you find that type of physician, in my role, it's like, how can I work with that person? How can I bring that person into my life more? If they're looking for a job, how do I onboard them into my practice? And Dr. Clark, Orthobiologics, we had nothing in our practice to bring Orthobiologics on board. We had no systems in place. We had none of the equipment, nothing. But when you and I met, I sat down with the other physicians. I was like, I believe in this man. I believe in this doctor. And I believe this doctor is the person to launch the Protea Performance Center as you know it now. What you bring to the table of Protea?
Yeah, I mean, when I first met Brendan and seeing what Protea was doing, to me, it felt like, they were doing everything to the best of their ability in the realm of endo and hormone replacement therapy and longevity. A lot of people talk about, medicine 1.0, 2.0, 3.0. We're kind of in that 3.0 stage. We're really focused on longevity, evidence-based, data-driven medicine. Whereas I feel like the current realm of pain management and how patients are being treated for pain, for musculoskeletal injuries is in that 3.0 range. Like 1.0 was medication, surgeries, steroid injections. 2.0 was the early stages of regenerative medicine, like you were practicing, around the 2010s. And I feel like in the last 5-10 years, we're now entering this 3.0 stage. And, when I went through residency, I was, lucky to work with someone who was very advanced in terms of understanding the most up-to-date science. And it, really opened my mind to how important it is to take this very seriously in terms of precision diagnostics, injections, follow-up, and very, very individualized care for that patient, which is also something that you guys are doing with the hormone side of things.
That reminded me of one of the first times I saw you, is that presentation that you did during your residency. That's what blew me away, is the way you presented how you approached orthobiologics and the science that you took to it that I didn't even know was available.